have specialists in hand, foot and ankle, knee, shoulder, joint replacements, back and neck injuries. There's really nothing that within orthopedics that we don't see and don't treat.
Well, a typical patient that I usually see in the office are mostly sports injury patients. Most of those patients have shoulder, knee, hip, elbow, ankle injuries.
ACL injuries as well as meniscal injuries of the knee. And of course I do a lot of joint replacements since I've been in practice for 24 years, and during that time I get to do lots of knee arthroscopies on younger individuals, and then as they age the knee wears out, and so I do a large number of knee replacements.
We are here to cover all musculoskeletal injuries: bones, joints, tendons, ligaments, nerves, and we really try to do it without any aggressive measures.
The process that I use to attain a proper diagnosis is essentially basics from medical school, which is just attain a good history and a good physical examination.
Your exam becomes really fine-tuned over the years to give you an accurate diagnosis. Once we're done with the history and the physical exam, we do the appropriate diagnostic tests, whether it's plain radiographs, utilizing the ultrasound, MRI, CAT scan, whatever we need to do to get an accurate diagnosis.
So once I go through the x-rays, make the examination, and then make my diagnosis, I can come up with a treatment plan that suits that individual patient and really helps them out in the long term.
Primarily, you can really change a patient's life if they've come in with an arthritic knee or hip joint. And by replacing those joints, give them the mobility and the ability to perform normal activities of daily living that they probably never had for quite a long time.
We may look at somebody's range of motion after a procedure and say, well, they have good range of motion, that's a good outcome. But I think it's more important to know what their goals were before, and if they've achieved their goals, that's a good outcome.